Morning, and thank you all for being with us today. Good to see you all. So I've been thinking a lot lately about what it means to be part of a community and what it means to be an American. And probably the election and the life we're living during the pandemic, but I really find myself thinking back to those who've helped America through other times of need and suffering. So almost 60 years ago today, President John F. Kennedy famously said in his inaugural address, "Ask not what your country can do for you, ask what you can do for your country." And I think that directive is more important now than ever. What he really wanted to do was launch a new era of selflessness, a time when we could take care of each other, block to block, neighborhood to neighborhood, family to family. So many have answered that call during the COVID-19 pandemic. We see it everywhere. We've got neighbors feeding neighbors, houses of worship, sheltering the homeless and the most vulnerable, community-based organizations working to make our county, our state, our country more perfect. And these and really many more countless acts of grace and love are evident every day across the country and our county. They're moving tributes to the power of individuals and organizations that make lives better, people stronger, families more resilient, and our community healthier. But in a crisis of this magnitude, spanning really every continent and people, it's really fair to ask what our country can do for us, what we can do together. So we are extremely grateful for the CARES Act funding from Congress that helped us save lives, prevent sickness, otherwise respond to the pandemic. It's supported our contact tracing, it's supported our quarantine center, it's supported our testing efforts, it's supporting our delivery of food to those in need, countless programs, and many people working on those. That funding ends in a few weeks at the end of the year, and we really have no idea if or when more will be coming. So our congressional delegation's really done heroic work to try to speed more resources to us where they're needed, but to date, nothing's worked. So we are not through this yet, as you know. We have many more months before we, I think, start to return to normal, and hopefully the vaccines pan out well and we get them distributed. But the pandemic is really at its most dangerous right now, and we need every level of government to be working together and working with us. We won't have, at the end of the year, federal loan programs, unemployment support, or grants to help ease the impacts of the pandemic on businesses and families. And I'm very worried what that means for families across Snohomish County and the country. So I just urge everyone to contact their member of Congress and senators to thank them for their efforts to date and urge them to continue working to bring more resources back home. A lot of people hurting, a lot of businesses hurting. We have vaccines to distribute. We have many more months of testing and contact tracing and other activities and delivery of food and standing up for the quarantine center and a lot of other activities that are going to have to continue into 2021, and we need that help. So now more than ever, we need to be working with our government, and our government needs to be working with us. So with that, I'll hand it over to Dr. Spitters from the Snohomish Health District.
Thank you, Executive Summers, and good morning, everyone. I'll be sharing a little bit about our vaccine planning efforts shortly, but before we get to the hope on the horizon, I just want to review the challenge facing us in the present and perhaps some insights from our past. Historians have shared how the second and third waves of the influenza pandemic in 1918, 1919, now a century ago, were far more severe when people grew tired of the mask mandates and restrictions, letting their guards down. They celebrated Thanksgiving and other holidays with relative abandon. And in the weeks and months that followed, the cases piled up and death tolls climbed. For several weeks now, I, other public health officials, Executive Summers, Governor Inslee, other elected leaders, scientists, business owners, doctors, nurses, and countless others are pleading with all of us to curb social gatherings and mask up. We have warned that we were heading into a dire situation if immediate action was not taken. Restrictions were put in place to try to slow the building crisis in our healthcare system about 10 days ago. And yet we find ourselves here today with Snohomish County and our state breaking record after record. Daily case counts, 2-week case rates, numbers of outbreaks. Long-term care facilities are scrambling to respond and control transmission while also needing to care for the residents that we've entrusted them with. Hospitals are rapidly approaching where we were back in March. As of this morning, we have 80 residents hospitalized with confirmed or suspected COVID in Snohomish County hospitals. 11 of those are on ventilators to help them breathe as they fight to stay alive. While the specific circumstances that led to those people catching COVID vary, a common thread in chains of transmission leading to their infection, illness, and hospitalization, and for many of them death, is a breakdown in our application of effective prevention measures that we have listed so many times. Perhaps someone needed to get together with friends, or they needed to have that birthday party, talking indoors with no masks on for hours, a perfect recipe for transmitting COVID. Or perhaps someone let their guard down because it was a trusted friend or a family member thinking, we can go inside, or I don't need to wear a mask, or maybe both. And it was just a small group of family members, so it was fine to take the mask off and give hugs. And then they brought it home with them or to work and infected someone else, who infected someone else who is now fighting for their life or may even lose it. So today we have 80 people with COVID in the hospital. That's a 400% increase in just 6 weeks. Statewide, there are 1,000 people in Washington state hospitals with COVID. Locally in March, we peaked at about 120 hospitalized, just 40 more than where we are at now. And we're on pace to surpass that within the next week or two. One of the key problems is that as opposed to 7 or 8 months ago with the first spike in hospitalization, there were other hospitals in the region to help absorb the acute care capacity that was compromised by that spike. That's not the case today. Hospitals are filling up at rapid paces, and they're running out of staff to care not just for COVID patients, but for everything else. All of us on this call today are concerned about what Thanksgiving will bring. We have read or heard sentiments from people to the effect of, we shouldn't cancel the holidays because we don't know if our loved ones will be with us next year, and nothing is guaranteed. Well, that certainly is true, but they, especially our oldest adults, are more likely to be here with us next year if we are able to collectively show restraint in our desire to gather together during this and other coming holidays. A surge in travel suggests that many people have plans to gather with people outside their household this coming Thanksgiving. But if more people don't cancel those plans this week, some of those guests or their loved ones or co-workers will become ill, some severely. This will worsen the existing hospital surge that will compromise care, not just for COVID patients, but also for people having heart attacks, strokes, appendicitis, trauma, you name it. Everyone's access to acute care will be compromised. That's the sober truth we're dealing with today. Now, as I mentioned, we do have hope on the horizon. We anticipate that one or more vaccine manufacturers will apply to the Food and Drug Administration for emergency use authorization for one or more vaccines in the coming weeks. If the FDA and then subsequently CDC's review of the data concur that these are safe and effective vaccines appropriate for use, we could begin to see the first doses of COVID vaccine shipped to our area within mid to late December. The Health District has been working closely with our partners in the Department of Emergency Management here in Snohomish County, the local healthcare system, and the Washington State Department of Health to prepare for this over the last several months, and that work remains ongoing. I want to let you know that the first limited supplies of vaccine will target healthcare workers and first responders at highest risk for exposure, highly vulnerable populations like nursing homes, and other older people with risk factors for severe disease. As vaccination of those groups is achieved and the supply expands over the course of months, Efforts will broaden to include critical infrastructure and public safety personnel, adults, other adults with medical risk factors for severe disease, and ultimately the general population. But this will take about 6 to 9 months to unfold. So although there is hope ahead, vaccine will not resolve our current problem or get us back closer to normal for many, many months to come, probably the third or fourth quarter of next year. And until we're at the other end of this, we all need to continue practicing the prevention measures you should all know by now. Physical distancing, wearing face coverings when out of the home, and limiting social gatherings in particular. That means we're still relying on all of you to bridge us to that point by keeping up with the masks and the physical distances, avoiding gatherings with people outside your household. This isn't just forever, but it is for now. So with that, I'd like to turn it over to Jason Biermann to share a little more about the planning and coordination our agencies have undertaken so far on the vaccine distribution front. Jason?
Thanks, Dr. Spitters, and good morning, everyone. I'm going to provide some comments on the ongoing planning efforts that we're working on with vaccine distribution, and then want to take a couple moments, to reemphasize some of the points that Executive Summers and Dr. Spitters made. As Dr. Spitters mentioned, our planning for vaccine distribution actually began back in early August, and it has been a partnership throughout the entire time up until now among the health district, for which we're really grateful. Our agency here, the Department of Emergency Management, the Sheriff's Office, our fire and EMS partners, as well as the healthcare providers throughout Snohomish County. Just to bring you up to date with where we are right now, we have completed a first draft, and actually last Wednesday on the 18th did what we call a tabletop exercise of that plan. That's an opportunity for the folks who are part of the planning process, as well as others who will be part of the implementation of the plan, to sit down and walk through how the plan is designed and to basically troubleshoot and ground truth everything that's in the plan. We did identify some things and have already made some modifications. One of the key things that we wanted to make sure we understood is throughput, and that is, approximately how fast the agencies that we're expecting to be part of this effort can provide vaccines. By our estimation right now, that's around 160,000 per week. So that's actually a fairly large number and coincides with what Dr. Spitters said in terms of the vaccine rolling out somewhat slowly. And a reminder that for everyone, the vaccine may be 2 shots that will have to happen over a spaced period of time. So we've identified that. We have an idea of what the throughput is. We've identified some of the issues that you may have heard about from other sources like ultra cold storage and other things. And that helps us identify ways to support our partners who are going to be providing vaccine out in the community. Most of those vaccines will go through normal channels. They'll go through the existing healthcare system. But certainly we want to be here to support that effort, and we being both the county and the health district and the other partners. And I think we have a strong plan that actually identifies how we will do that. And with that, the other point I wanted to add to reemphasize what the executive and Dr. Spitters have said, certainly everything they said is obviously spot on, but thinking about those responders and the healthcare system and the providers that are out there, I would also ask folks to consider your gathering and limiting that, because they are also at very high risk. Every time they go out, be it an EMS provider going out for a call for someone in respiratory distress, someone who comes into the emergency department, any of those instances cause strain on an already strained system. And staffing becomes a big issue when folks who are in that healthcare system become ill and have to be taken out of work. There's a finite amount of staff. That seems intuitive, but I think it's important to stress that those folks are out there every day, not only trying to address COVID, but all of the other issues that are happening throughout our community. So I would ask on their behalf that folks be mindful of that, and also think about when you're gathering the increased risk that you're creating for our providers, our responders, our law enforcement folks who are out there in the community trying to keep people safe and get them the help they need. So thank you.
Thank you, Jason, and thanks to you and everybody at DEM and at the Health District for the great partnership we've had these past months. We've got some work ahead of us, but thank you. So this question for Dr. Spitters and I, what is seeing all the people at airport terminals jammed with holiday travelers done to your blood pressure, and what do you expect to see happen after that? And just like to hear from both of us. I would just like to say that it's not so much my blood pressure as it is sadness, kind of a deep sadness, because all we can do is give people the best advice we can, and then it's up to each individual and each family to take it or leave it. And travel is down. That's a good sign, but with the level size of crowds we're seeing, I think it's going to be a hard winter. I think it's we're going to continue to see cases rise. There's no indication that that's going to let off anytime soon. In fact, indications to the contrary. So it's going to be some tough months, particularly with the end of federal assistance come January. We have some bridge funds to try to tide us over into 2021. But it's going to be a tough few months, and I'm just going to keep telling people what I know and what the best science is and what the best advice is, and hope they take it, and that we mitigate the increase in the spread of the virus as best we can. Dr. Spitters.
Well, yes, I just, it's certainly concerning the amount of, the interest people have in getting together over the holidays is runs counter to what we need to have happen. So seeing lots of people traveling is concerning, that there will be a wave of disease in follow-up to that by a week or two. And then again, the aside from the suffering and possible death associated with that, again, is the swamping of the acute healthcare system that could result. And so widespread gatherings, just are working completely counter to our hoped for strategy to try to mitigate things as we move ahead.
Doctor, do you know offhand what our cases per 100,000 number is this week?
Yeah, it's just up over 300. It's 304. So through the 2-week rate through the 14th was 278, and the 2-week rate through the 21st was 304. So about a 10% increase. That's a slower increase than the successive 50% increases we saw in prior recent weeks, but it's still going up. We really need to see that come down, because all of those cases, a relatively constant proportion of them lead to hospitalizations, and these are long hospitalizations typically. So the folks stay in a long time, and that starts to crowd out other things that need to be taken care of. So that's where we're at, 304.
Just a reminder, we dipped under 25 in the spring to get into phase 2. So can either you, Dr. Spitters, or Jason, further detail how vaccine will be distributed to the public?
I'll take just from the medical view, and I think Jason's input is also going to be helpful here. But the general idea is that the majority of the healthcare system providers are the majority of the healthcare systems are signing up to be able to order and receive vaccine, and then administer it initially to their workforce, and then ultimately to high-risk patients, then medium-risk patients, and then low-risk patients through their routine healthcare provider. So the vast majority of people in Snohomish County, ultimately, when the timing's appropriate for them based on their risk, ought to be able to get it through their routine source of healthcare. And then for those who don't have a routine source of healthcare, that's where we'll be working on developing relationships to either provide incentive to the existing healthcare system to take care of those folks, or to create means to directly administer it ourselves. Jason, you want to comment on that?
Yeah, I think you covered most of it, Dr. Spitters. I mean, generally, I guess starting sort of at a higher level, the federal government, CDC in particular, will coordinate with State Department of Health, who will in turn coordinate, of course, with the health district about getting the vaccine here. Most of it we expect will go through those existing channels. A lot of our planning has been to backstop that. We do know that there are folks who may not have a healthcare provider or a medical home. So we do have, as Dr. Spitter said, some things in place and plans in place where we could, if we had to, go out and either use existing mechanisms like the fire and EMS community, who has stepped up and said that they're willing to help provide vaccines the way they did back during H1N1. Or if if necessary, we could stand up points of distribution where we would be doing that in conjunction with the health district and providers out in the community. But again, generally, our assumption is that most of the vaccine effort will go through existing healthcare networks and both clinics, hospitals, and pharmacies.
The next question is, at any point, will there be repercussions for those that violate orders? And we'll just say there have been repercussions for businesses that have sort of flagrantly violated orders. Those are probably the easiest cases to deal with if they hold permits or licenses from either local government or the state, most likely. Individuals and families, extremely difficult. Doctor, do you have any comments on that?
Well, I think that's precisely it, Executive Summers, that there are some, visible, grossly non-compliant folks who, generally that would occur in a setting that's regulated, right? Like a business. And then, I think we've heard about a place or two that have had their liquor license pulled because of non-compliance. But the vast majority of transmission is occurring in other settings, and we really are at the mercy of our collective will to limit those events from occurring. And so there is no meaningful enforcement on private homes, which means we really, as I said, we're entirely dependent on everybody thinking of the collective here to try to limit this, because there's no other way to do it.
Okay, with an eye on Thanksgiving, have tracers been able to connect any cases to Halloween gatherings specifically?
Not that I'm aware of. I think in general, the willingness to there's certainly some embarrassment, I think, among folks who become cases connected with gatherings. So what we hear is probably an underestimate of what is actually occurring. Nothing specifically tied to Halloween itself in name, but just two small gatherings, parties, birthday parties, dinners, etc.
I think you can kind of infer from the timing of this increase, as people move indoors and we started to get into holidays, and we see this peak. So I think it's the state of North Dakota, I heard, is really almost abandoned contact tracing because they've completely overwhelmed their capacity to really be able to meaningfully trace to small events or individual events. So I think that's a concern of mine, that as we get more and more cases, it really becomes extremely difficult. Contact tracing is most effective when you can sort of hit outbreaks when they're small and targeted, but as this gets more widely spread, I believe that's a less valuable tool. How much more room do the county hospitals have to admit more COVID patients, and how many total COVID beds are available in total?
So, we collaborate with the hospitals on that, but that's a question better answered by the hospitals themselves or the Northwest Regional healthcare network. They're the ones that are coordinating the surge capacity.
Gonna unmute. Given the lag from symptoms to hospitalization, at what point would you expect to see higher death rates than we see right now as it relates to current increase in cases?
Generally, what we saw last March and April is that the hospitalizations peaked 1 to 2 weeks after the case reports peaked, and then deaths peaked another week or two after that. So we don't know if we've reached a peak yet, but we're certainly in a surge in cases. We're seeing the hospitalizations go up in tow. And so I think anytime now we could start to see, we've already seen a lower level of deaths, along the roughly half a dozen a week over the past couple of weeks. And that is, I think, certain to climb. Quality of care, as well as some of the pharmacologic interventions for COVID, have improved greatly since the winter months last time through. But still, I think these numbers suggest we will see increased deaths in the coming weeks.
So I think, Doctor, we are seeing increased deaths, but it hasn't reached kind of the magnitude that we saw in the spring. Is that correct?
That's right. That's right. Going back to that time, I think we peaked at roughly 20 to 30 deaths per week in early April, and now we're at about 1/4 of that. But I would expect that to increase to double or even triple in the next week or two.
Okay, another question for Dr. Spitters. Another death was reported outside of this county yesterday in a child between 0 and 19, the fourth in the state. Any comments in general regarding the risk to that age group?
Well, first, it's a tragedy, and I was not aware of this, but certainly my heart goes out to the family involved. And if you lose someone in your family at any age, that's painful, and that's part of what we're trying to avoid here. I think, our emphasis, I wouldn't say overemphasis, but emphasis on the age-related risk of severe disease and hospitalization and death might mislead people into thinking that it's a benign condition for younger people and children, which it's not. Certainly, frequency of hospitalization is lower and deaths are lower, but as this sad case shows, even in the youngest, least vulnerable group, bad outcomes do occur. And, I've mentioned this before, but another thing is, even for people who haven't been hospitalized in these recent studies, when you go back around and talk to folks 3 months later, up to half still have difficulty breathing, chest pain, feeling tired, having difficulty thinking, and kind of getting through their day 3 months after they were initially ill. And this is in all age groups. So this is not a benign condition for sure.
Well, there's a question, I think, for Dr. Spitters, but maybe Jason wants to weigh in on this too. So when do you think COVID hospital numbers will break pandemic records if the trend continues? And do you think Snohomish County will have to consider field hospitals?
Well, we certainly got there we were right on the brink of that last March. And of course it could happen again. It's very difficult to predict the future. So I'm reticent to do that, but it's certainly in our future if we don't turn things around. That's for sure. When depends on the slope of that curve, and the more we can bend it and get it going down, the more likely we can stop the inflow of hospitalized patients before we exceed capacity. If we don't bend that curve down, we will exceed hospital capacity. Would it be, 3 weeks from now, 2 weeks from now, 5 or 6 weeks from now? I won't venture to guess, but that is in our future if we don't turn this around quickly.
Jason, you are heavily involved in planning for the potentiality of field hospitals. Would you like to say a few words on that?
Yeah, I'll add, as Dr. Spitters mentioned, we had plans in place. We'd actually had sites identified back in the spring for a field hospital. We don't want that to happen, obviously, but we do have plans in place for where we would site those. I think one thing that's important, again, to emphasize and re-emphasize Dr. Spitter's message, many of the assets, the federal assets that were available in the spring are now deployed elsewhere throughout the country, as the whole country is seeing this massive uptick in COVID cases. So while we have those plans in place, the number of resources available are far fewer than they were in the spring. So again, that's just a strong reminder to everyone, those measures that keep that curve flattened and keep us out of the place where we have to request those things is where we absolutely want to be, because there's not a guarantee that federal resources will be available, because they are being used all throughout the country right now.
Okay, question about testing and positive case are case percentages really reaching 10%, or is that a facet of Department of Health reporting getting overwhelmed with testing numbers and asking not to collect negative tests if possible?
No, that's a real number. 10% of tests done are positive in Snohomish County.
And doctor, it's fair to say that testing is up across in the spring, direct contact, but there's a lot more people doing the drive-through testing and planning on traveling. So I think we're probably getting a more representative sample of the population now than we were in the spring. Is that accurate?
Yes, I think we're probably testing a wider variety of people who are seeking testing. Back then it was, the positivity rates were, 20%, because most of the people that were seeking testing were seeking it because they were sick. Now there are people also seeking testing because they're contacts, or as you said, for other sort of administrative purposes, travel, work, etc. So that adds to the denominator. But we're doing 13,000 tests in last week. That's double what we were doing about 6 to 8 weeks ago, and yet the positivity rate has tripled over that time. So that gives you an idea of what's going on in the community. There's just a lot more transmission, and this is real. This is not an artifact of how we're counting tests or anything like that.
Can you talk about the outbreak at a hospital with 14 cases? Are cases among staff, or has transmission become uncontrolled? And if uncontrolled, will you be identifying the hospital? And then a follow-up, do you think the focus on limiting gatherings neglects how many cases we're seeing at workplaces across the county?
Well, I'll take the first one. We are working, the health district is working actively with Providence Regional Medical Center in Everett on COVID-19 prevention and control efforts affecting their hospital. The health district continues to provide technical assistance as well as support completing case investigations and contact tracing related to the outbreak. The facility is handling notification and tracing for patients and staff, and the health district takes care of those notifications located outside the facility. Again, with this much transmission occurring in the community, whether you're a long-term care facility, a hospital, a school, or workplace, the chances of COVID walking in the door are now 10 times higher than they were when our rates were down when we fell below 25. So there's just more COVID out there. It comes in the buildings, and Providence and the vast majority of healthcare facilities and other enterprises we're working with have good control measures in place and are being very cooperative and taking our advice and working on controlling things. And we generally see transmission come under control. But this is going to be at these levels of transmission in the community. We should expect more of this in the near future until we really turn things around and get the incidents in the community down so that there's less COVID walking through the door.
So we have a couple of questions on vaccines and distribution, and then we'll wrap up. The first, can we identify the facilities that will be distributing the vaccine in the county? Is there a target date for vaccine distributions, Christmas perhaps? And there was a question I missed, which was which company will be supplying the vaccine across the county? So both for Dr. Spitters and Jason.
Yeah. Well, I'll make a couple comments. First, as we said earlier, the vaccines will generally be made available through the existing healthcare system. So if you think about the major healthcare system players, those are the likely venues for vaccine becoming available. No timeline, a guesstimate of maybe sometime in December, but it could be delayed. It could be longer than that. And certainly in my medical ethics career, we always shy away from any endorsement or mention of any specific enterprise that's providing goods or services. But so one or more pharmaceutical companies, though, will be submitting applications in the coming weeks to FDA for their vaccines, and they will move forward if they're deemed safe and effective.
And Dr. Spitters, when I asked you about this the other day, I think said that we have a pretty well-defined system for distributing flu vaccines, for example. They're widely available, and that essentially that same system for distribution is what will be used in this case. So at some point we could possibly see vaccinations at Costco or your local pharmacy, et cetera, et cetera. Is that?
That's right. In fact, part of the federal effort, Jason, you may know more about this, but in concept, part of the federal effort is to work directly with some vendors like that, like some of the major pharmacy chains, to directly distribute to them and not necessarily go through the state or the local health department. So yes, in addition to traditional healthcare venues, you've got those. And then as well, we'll either have some type of, voucher system or direct delivery for those who are uninsured, don't have a healthcare provider, kind of otherwise might fall through the cracks. We have some contingency plans for that as well.
Yeah, that's exactly right. And I think the only thing I want to add is just to recognize those local healthcare providers and those systems. And again, you mentioned, Dr. Spitters, it's the ones that folks recognize from the flu vaccine, and just the ones who are present in the county and throughout, including the pharmacies, have been really good partners in our planning efforts. So it is those same systems that we know about, that we use for flu and just general healthcare. They've been really strong partners coming to the table and helping inform our plans. So I want to make sure we recognize them for that.
And I guess I'd just finally emphasize to remember that when the vaccines do start coming, it's going to be a limited supply. I mean, the whole world is waiting for vaccines, and it's going to take some time to ramp up production and do distribution and get out to the general public. So it's not going to be a massive wave of availability, I don't think. We're really looking at well into next year, as we've said many times, clear into the spring and summer before the vaccine has really been widely available and distributed. So I think that's it.